So this is an image of essentially a very thin-skinned leg. So we can see on the left the vessels become much more visible. The skin looks generally thin and that it may break easily, and the picture on the side there is just of a dry leg. So just a very small clue as per the examination on things that might be relevant to document, or things that may be suggestive, but certainly this is not going to be diagnostic. This is an image of a patient with peripheral artery disease. So you can see the hairless legs. You can see the mottling on the lower legs. I think sometimes that mottling is considered to be very apparent, the blues and the reds, but it may just be that the skin is just generally mottled and the quality is waned. You can see here at the feet, the nails are very short and rigid. You can see that there is shininess around the feet as well, and that is seen in some patients with peripheral artery disease. Importantly though, these things, I don't think it's going to be the make or break. I don't think we're going to rule patients out completely with this, unless and it's not going to be highly suggestive unless they've got these end-stage disorders, and certainly some patients don't have this, but they do technically have peripheral artery disease. So just something to think about. This is that sunset foot that we mentioned. So foot becomes very, very red, important in that Berger's test, but if a patient crops up and they've got unilateral, very red foot or very red thigh, we want to be talking about that. We want to be asking about that. Here's one of those nails. Just rigid, don't grow very well, thickened, they may be discoloured. This patient has peripheral artery disease. And this is just an image of so ulceration in your feet. So we want to be looking at the bottom of the foot, we want to be looking at the back of the toe, we want to look between the toes, we want to be looking at the heel, the back of the heel. We don't want to be missing tissue loss. And the picture on the other side is basically a gangrenous foot. Okay, so that foot essentially has died.